So the new living room area consists of comfortable chairs, sofas, soft furnishing and improved lighting. We used natural shades to promote a calming effect and also purchased a large aquarium tank filled with tropical fish. So why did we do that? Well, to reduce physical and verbal aggression, to improve social interaction, to encourage individuality, and to reduce anxiety, as well to improve the well-being of each resident, job satisfaction, and as well improved relations with family and staff. Improvements which we observed, well, residents with depression and delusional disorders have thoroughly enjoyed the process of going shopping and buying their own items. Residents' moods were lifted and it appeared to give them more of a focus and a grasp on reality. Staff, the improvements observed as well was that staff and residents take more pride in their environment to ensure surroundings are kept to a high standard. Residents who self-isolate have become more motivated to interact with others and want to keep improving their home. So to conclude, we believe that all continuing care units could benefit from our initiative. We have taken risks, but with clear assessment, these residents can have items that you or I would want. It has touched the residents' hearts and minds and helped everyone who cares for them to see the true person. What would you prefer?
So, ladies, I don't know how you feel about questions. Take a few questions. So there's a hand straight up there and another lady there. So we've got 5 minutes for questions. So far away.
Excellent presentation. You've nearly reduced us to tears, by the way. And you're a credit to nursing, which is absolutely brilliant to hear.
Thank you.
I just wanted to ask, I'm thinking about my junior staff nurses who might want to introduce something to our area. Did you get support from senior level, or did you have a battle, or was it just easy? How did you do it?
No, we had 100% support. Our charge nurse is fantastic. Yeah. Absolutely.
Yeah. So was it solely down to you working with your charge nurse? Did you need any other support from anywhere else in your organisation?
We didn't need any support from anybody. No, our charge nurse just believed that the idea was great, and we were just to go ahead with it, and it's had such a domino effect on the ward, so yeah.
Carry on, good luck.
Thank you.
I would echo those congratulations from everybody in this room. I think part of my question has already been touched and just answered, but we heard from Professor Harry in Wales some of the blocks from management, and it would appear in Scotland it's slightly different in terms of, it was just really to understand the drivers for this initiative and where management did sit and support, or as you've already articulated, that came from your own group, and how that spread, has it spread, is that initiative that's gone outside of your own home, and what are the plans to extend that to your knowledge?
Well, we hope that this is going to help us, promote it a bit more. As I said earlier on, throughout my training, I never ever saw as much as a bunch of flowers in anybody's environment when I was working alongside individuals with mental health conditions. So hopefully this, along with word of mouth, will kind of give us the go-ahead that we want. We've had a lot of support and a lot of encouragement, and we're really quite surprised that we've achieved what we have, to be honest. Yep.
Other questions? There's a lady here on the front row in the nice pink top.
Somebody else can answer that one.
Hi, I just wanted to know how many of the things that you think, for example, in other acute mental health wards where we've worked with our local mental health unit and gone in and done art activities and things like that, they've had really strict regulations about ligature risk and all those kinds of things. Like I was watching, you've got lovely hanging things and lamps and stuff like that, but how much of what you did with people was not about those kind of dangerous objects in the eyes of someone who loves to do a risk assessment form for fun? What would you suggest that other people could do where they're not allowed to use all the pretty objects that would pose a risk?
I'm not sure.
I mean, did you paint
No. We worked with, you know, the patients themselves about which colour they would like, and then... Yeah. Uh-huh.
Well, they're redone every so often anyway. The rooms are repainted, you know, after so many years.
So it was more about taking the patients out and letting them choose like their own cushions, if they wanted a picture, you know, personal things, even trying to get in contact with relatives, for them to bring in personal things that, you know, mean something to them, you know, that they would have if they were at home.
Any other questions? One at the back, making you work today?
It's probably not so much a question as I think it's wonderful that you have won the award, because in turn the people you look after have won the award as well, because what you've shown us through what you've applied and they've chosen, it's something that they're going to be proud of as well. So I think it's wonderful.
Thank you.
Yeah, just again to echo the thanks for the presentation. I think in terms of discussion about risk, it's just a comment again about, as organisations, how risk averse we're becoming, and what's the risk to both patients and staff to live in dehumanising environments where people aren't proud of where they work or the care that they provide, and how often we take to reflect on those risks versus other things we hear about. So.
Yeah. Any last questions? One, and we'll make this the last question. Thank you.
And again, it's a comment really, and I did speak to you earlier. Congratulations. It's when I was talking to you, you have captured such a lot of anecdotal evidence about the residents' behaviour and their moods, and it's really just to say out loud really that the next step for you is to capture that formally in terms of rating and reporting those clinical outcomes for the residents, because we're in a time where innovations like this are hard to come by, because A, we're risk averse, and B, there's no extra money. But if you can demonstrate that by doing this, actually you have positive clinical outcomes in terms of behaviour and mood and interaction, all of those things about resilience and well-being for your residents, that will not only help to generate more of what you've done and to sustain it, but it will encourage other wards and other hospitals to do the same. So congratulations.
Thank you.
Super. Thank you very much.